Hey, Julia.
Hi, Dr. Landry. How are you?
I'm great. Welcome.
Thank you so much.
You're welcome.
And so where are we headed back to right now?
We are headed back to the women's clinic at UHS.
Cool.
We're going to walk to my office first.
All right, awesome. Okay, I'm just going to put my stuff down.
You bet.
Okay, and then what are we going to do in our appointment today?
So the appointment today, you've scheduled a wellness annual appointment, or what we call a prevention visit, but it's annual. And we're going to, because you're due for a pap smear, we're going to do a speculum exam with that pap smear, and then complete the pelvic exam by feeling the uterus and ovaries.
Okay, so where are we right
So
now?
this is now an exam room
Okay.
in Women's Health Clinic, and it's pretty typical of an exam room in any type of Women's Health Clinic. There's an exam table that has footrests to help support the heels so that we can do a pelvic exam. And again, most clinics have such a table with a light so that we can see into the vagina, to the top of the vagina where the cervix is. So come on in. What we first do is spend a lot of time reviewing what your concerns and priorities are, what preventative needs or questions you have related to your reproductive health. And then if we decide together that you need a pelvic exam, then we would do the exam.
And what's first?
So we're going to use this model rather than a live person. So this is the vulva and pelvis. Okay, so first we would have the patient position with their bottoms off, including underwear. This sheet drapes over the lap, so we'll pretend the rest of the person is here.
Mm-hmm.
And when it's cold like it is now in November in Wisconsin, we use the sheet to also cover the legs. And then we use a speculum. The speculum is warmed in a warmer drawer, and it's a little bit bigger than a finger and allows me, by separating the walls of the vagina, to see the cervix at the top. Now, if a woman has not been sexually active but is having a concern that we need to evaluate, like heavy hemorrhage type bleeding, we have speculums that are smaller than this. We also have them that are larger for women who've delivered babies. Smaller and even as small as the actual size of my finger.
Wow.
So most women who are sexually active can easily accommodate a speculum that's this size. We use warm gel to put on the speculum so it slides and doesn't pull on the skin. So first step of the pelvic exam is the insertion of the speculum. Normally a woman's vaginal opening is not gaping like the model, so we gently separate the labia with pressure from our fingers, place the speculum, pass it up into the vagina. No pain, as long as the woman can relax her muscles, and the warm speculum helps with that, and our reminders that she should breathe. And then we open the speculum, and with the use of a light, we can see the cervix.
Interesting. And
Yeah.
so there shouldn't be any pain?
No pain. Pressure, yes, just like putting in a tampon, you feel pressure. It's the same kind of pressure, but no pain.
Okay.
So to do a pap smear, what we do is we take a little spatula and a brush, and again, when you're 21, spatula, and we just gently, just like rubbing on the skin, rub on the skin of the cervix. And the cervix, even though we sometimes think that it's hypersensitive, it's actually not sensitive at all. And so at most what a woman feels with that is a menstrual crampy sensation that's very mild but familiar. Same thing with the brush. We pass it into the cervical opening and then remove it. So the pap smear takes about 3 seconds.
Wow. Okay.
The speculum's then removed. And then we move to the second part of the pelvic exam, or what we call the bimanual. So the bimanual exam, or the second part of the pelvic exam, is done with a finger in the vagina where I feel the cervix, and with a hand just above the pubic bone, I can feel a woman's uterus. So I can feel the uterus, and I can feel that the ovaries are normal size, which should be small, about the size of ovaries on this model. That's a bimanual, does not hurt. And then the pelvic exam's over.
And then how can every student, but maybe particularly women, benefit from a visit to the University Health Services Women's Clinic?
I think the biggest benefit is understanding your health. So it's about information, it's about understanding your body and how your body works, how it's normal, what might be not normal, and whether or not you need care to help prevent problems that might in the future make your reproductive structures less than healthy or normal. So it's really all about education. Most care is available and free to students at UHS because you pay for it, pay for us to serve you through your segregated fees. So a visit helps you to individualize what your health care needs are with a discussion and sometimes with an exam.
Okay, well, thank you so much. I really appreciate you taking the time to talk with me.
You're welcome. Thanks for being so interested in women's health and reproductive health care.